I'm Candace Donaldson. This is my final paper for Nursing Leadership. I'm doing mine on wound care policy change. I have two people I'm teaching to. Okay, wound care policy change. Useful and effective wound care changes frequently are due to new evidence and products. These changes make it difficult for smaller hospitals to keep up-to-date wound care policies and procedures. Physicians, along with providers and nurses, need up-to-date information to be able to treat hospitalized patients and wound care patients with chronic wounds appropriately. The hospital I work at here is a rural hospital. We don't employ a wound nurse from this hospital. Because of financial constraints. Wound care products are changing rapidly as new evidence surfaces. A lot of times the staff is restricted to wound care products, and normally the policies and procedures for wound care are over 10 years old. A lot of times physicians and nursing staff have limited knowledge of current products and new evidence as far as wound care goes. So as far as our hospital, the medical chief of staff, the director of nursing, has to request a review by the administrator before changes of any policies are made or any new products are reconsidered. So the chief of staff felt that new policies needed to be implemented to have better patient outcomes and wound progression and healing and reduce bacterial burdens. Since the hospital has a modest budget for ordering wound care products and supplies, there needed to be careful consideration and evidence-based research and product reviews to make a change. Those changes will be determined by the physicians and the administrator. So once the new policy and procedure was completed, medical chief of staff and other providers within the hospital must confirm it. And then after the confirmation, it's essential for some type of educational in-service for all nursing staff about the policy, procedures, and product changes to be completed. Shared leadership is a great leadership theory for this certain change in the wound care policy. We do our wound care here through the ER on Wednesdays. So when changing any kind of wound care products, formulary, insight from departmental leaders, material manager, director of nursing, medical chief of staff, different physicians, providers. There's a lot of people in the team that need to be involved. The materials manager, as far as cost of the products, director of nursing, because implementation and educational process of the changes, medical chief of staff can direct and educate others, physicians and providers. The administrator can give approval for the product purchases, and the nursing staff actually has a duty to carry out the policy and procedure for the new products that are ordered. So everyone has a role in the successful change in product. And I think if everybody has a role, then they're more invested in the time and the product and should have a better outcome. In doing the research for the different products, external wound care specialists could be consulted to ensure up-to-date evidence-based practices are put to use, and the better, newer, innovative products are introduced that way. Case managers can be involved for external agencies as home health care, and they can adjust their product list to ensure the care of home health patients. All physicians with privileges here at the hospital would need to approve the policy and procedure change. The nursing staff all must be on board and follow the protocols to ensure a successful change. The resources needed are willing participants. So the plan to change in the policy should be introduced to all key personnel in the hospital. Providers and lead nurses need to be notified of the pending changes, giving them the opportunity to insert their opinions and ideas. Provide multiple sources of information to providers and lead nurses affords them opportunity to make decisions that are safe, evidence-based, and cost-effective. One person should be assigned as a change agent. The change agent is the one that sets the plan into motion, and then all the necessary products should be ordered. Support staff should be educated on the use and the purposes of the wound care products. And then when the policy change is rewritten, it needs to be approved by the committee, normally med staff. Evidence-based practice is essential in providing up-to-date and efficient wound care. Also, it's used to gain information about new and effective wound care dressings and products. It could benefit the change agent in rewriting the policy and updating the procedure. And they can ensure the policies are worded and written to reflect the best of evidence-based practice. To measure that change, the hospital staff will need to keep records of the wounds that are being treated here in the facility, measuring the wounds weekly to monitor improvement, make sure the effectiveness of the policy change. If wounds are healing, change could be considered effective. If they're not changing or declining, different factors would need to be reviewed. If they're not improving at all, the products need to be reviewed, and it may be an issue with education, and the staff may need another in-service on how to use the products. So, in conclusion, evidence-based practice is the most important to any policy change in the medical field. Wound care has always been one of the most overlooked things, but millions of dollars are spent each year trying to heal wounds that could have been prevented. So wound care research is now at the forefront of most medical researchers, and it's hopeful that more nurses and providers will become increasingly interested in prevention and healing of acute and chronic wounds. Thank you.